have the prettiest babies that ever walked the face of the earth, don't I? Don't I? Oh, daggone it. Say hello. Say hello. Oh, see how pretty he is. He does get excited when my mama baby dog's mean, don't ya? And this baby down here, want to see this baby? Oh, come here. Come here. Come here. Say hello. Say hello. Tesla's getting in the way. Oh, I see a baby. Oh, can you see her? Oh, I think so. I think so. She's a party baby. Yes, I know. And Lucy, oh, she's crashed out over there. Yes. Now I stirred him up. Oh my goodness. Hi, beautiful people. How are you? I'm Dr. Pammy Jean. I hope you're having a great day. Well, this is part 3 of our conversation about histamine intolerance. I find it all very interesting. I hope you do too. Because as usual, I over-research and yet I still have questions. And so if you have questions, please put them in the comment section because we're in this together. So we're ready now to talk about the symptoms of histamine intolerance. And to do that, we need to talk about DAO deficiency. DAO deficiency can cause various adverse effects on various systems of the body, such as respiratory, which is like nasal congestion and asthma, cardiovascular, like hypotension, hypertension, and arrhythmias, and our central nervous system, like migraines, headaches, hangover. That's what it says. Not sure what that means, unless some people just have a continuous hangover effect, dizziness, and digestive issues like irritable bowel, constipation, satiety, stomach pain, vomiting, and muscular symptoms like fibromyalgia or muscle pain, and skeletal problems like osteopathic pain. These are all symptoms that many of us have. Maybe not all of them, but many of them. I mean, do you? I do. And also, researchers stated that the AOC1 gene variant, SNP this, is associated with low enzyme activity and may be associated with fibromyalgia symptoms. All of those that I listed in the previous video are also linked to fibro. This one specifically, I guess they're saying that this SNP is with low enzyme activity. And I know that I have digestive issues, so like IBS and GERD. This is how it's explained in my genetics. And I need to take a digestive enzyme pretty much after every time I eat food. It doesn't want to digest properly, and I get a terrible tummy ache. That helps me considerably. And I put a link to the digestive enzyme that I use in the description section below if you're interested as my favorite digestive enzyme. Large amounts of histamine accumulating inside the body can lead to a variety of symptoms, many of which are also endured by many fibromyalgia sufferers. Some signs of intolerance include headaches, sleep problems, low blood pressure, hypertension, acid reflux, anxiety, diarrhea, fatigue, runny nose, bloating, nausea or vomiting or stuffy nose, shortness of breath, itching, rash or hives, flushing, irregular or fast heart rate, swelling of your lips, tongue, or throat. That's all interesting, isn't it? In more extreme cases, too much histamine in the system can cause asthma or irregular heartbeats. Some people also report severe itching on their skin or vertigo. Not everyone who experiences this intolerance will also suffer from fibromyalgia, and not all fibromyalgia patients have histamine intolerance. Histamine intolerance testing methods include several approaches to serve as a specific purpose in identifying this condition. So before considering histamine intolerance, it's recommended to order a skin prick. And I've done that where an allergist has you lay on your tummy and they prick your back to test for specific allergens because they've got a little bit of that allergen on the thing that they do to prick your skin, and they look at the reaction that you get. I've never had a food prick before, but remember, true allergies usually cause one of the following. Mine was for environmental allergies, so I'm assuming this means either way or both. Or they suggest having an antibody testing to rule out IgE hypersensitivity that could be caused by dietary or environmental allergens, which can induce high histamine responses and mimic symptoms of histamine intolerance. Serum tryptase should also be ordered to evaluate for mastocytosis or mast cell activation syndrome, also called MCAS, which are much more serious conditions on the histamine spectrum. When you are tested for histamine intolerance, they'll test you for histamine and DAO. Usually a blood test will rule out food allergies, but a blood sample, maybe not allergies, maybe intolerances. But a blood sample can also analyze whether you have a DAO deficiency. Is that what this is? That's what I did, basically. At least if you want to look at it from the DNA side. So I don't know if there's another blood test specifically that says, hey, you have DAO deficiency. It's really interesting. Do you know? I didn't research that, but now I wish I did.
There are blood tests to detect DAO, diamine oxidase, deficiency, often related to histamine intolerance. These tests measure DAO enzyme activity, indicating its ability to break down histamine. A low DAO level or activity can suggest a histamine intolerance issue.
So a histamine intolerance test is diagnosed by a physician who believes in histamine intolerance and rules out other conditions first. An allergy or GI specialist may be needed. There are doctors who just don't want to listen, and they're set in their ways. And when that happens, it's time to find a new one. Some foods contain a large amount of histamine, but histamine intolerance is not a food allergy. It's not a food allergy. It just means that certain foods might increase the symptoms of histamine intolerance. So the following foods are suspect in those with histamine intolerance. And you can see this whole list of foods. Chocolate concerns me because I do love chocolate. I don't eat candy bars or anything, but I do put 100% cacao in my coffee every day. So, the low histamine diet aims to reduce the symptoms of histamine intolerance and allergies. But there's limited evidence to suggest the diet may be helpful for some people. In a small 2018 study, a low histamine diet over 4 weeks helped reduce symptoms in adults with hives. However, we need more high quality studies on histamine intolerance to better understand the condition and the best treatments. Just remember, there's no one size fits all approach to nutrition, and an individualized approach to diet is often best for people with intolerances, including histamine intolerance. So, I'm not going to remove these foods unless I, find that I have truly this is histamine intolerance. I just don't need to otherwise. Have you tried a low histamine diet? I mean, there's a DAO test, and researchers seem to believe that we could possibly have this issue as fibromyalgia patients. Reportedly, these are foods lower in histamine. I mean, gastrointestinal problems seem to be the most often issue that is experienced by people with fibromyalgia and this histamine intolerance. And that's important to me. So, what do you think? That's what matters about all of this, because this is all for you. It becomes overwhelming for me sometimes. And so I had to find a place to stop because I could just go on and on. So if you have questions or things that you would like me to cover about histamine intolerance, I'd love to investigate those for you, or any other topic for that matter. So I hope you learned something. I send you gentle hugs and support. Love you.